Father's Day here. It's a good time to talk about men's health because we all want our dads to stick around for as long as possible. This morning, Dr. Kaushik Shah joins us to talk about some big changes when it comes to prostate cancer. But let's first talk about what it is and how many people it affects.
So I think it's a relevant topic for Father's Day. So basically, you've got the bladder, and underneath the bladder is the prostate. And the prostate is a male organ, a sexual organ for reproductive purposes mainly. But what happens as you age, the prostate grows. That could lead to urination problems or things like that, or prostate enlargement. The other thing that can happen is that it can become cancerous, the prostate, so you can get prostate cancer in that organ as well, again, as we age.
Have treatments improved over the years?
So what has happened is the treatments have improved quite a bit over the years. So, you know, nowadays if we detect prostate cancer early enough, vast majority of patients will actually be cured as a result of that.
Let's talk about the changes that have come recently. There was some controversy with women's health and breast cancer. Now we're seeing it with men's prostate cancer. What's going on? And
that's the best analogy I can make is, you know, everyone has heard about Angelina Jolie and what's happened lately, that she was BRCA gene positive, which indicates a more aggressive variant of breast cancer. Thus, she went with the prophylactic bilateral mastectomy. We don't have that analogy for men yet, and that's one of our problems. We're not as advanced in terms of genetic screening, and we've really realized that there's actually hundreds, if not thousands, of microgenetic variants of prostate cancer, and not everyone is going to die of prostate cancer. Some are a little bit more benign and slow growing, and some are more aggressive and could actually kill you. So our goal is, how do we find those bad ones?
And what's interesting is, instead of saying more men need to be screened, it's actually just the opposite right now, at least according to the Urological Association.
Right, and so 1 in 7 men, which is quite a bit of men, quite a number of men, may actually be detected with prostate cancer in their lifetime, so 1 in 7. However, the latest data suggests only 1 in 1,000 or so may actually die of the disease. So we want to identify which men will die of the disease and which one will die with the disease in their lifetime.
And so there's actually some ages, so if you're sitting at home going, what does all this mean? How do the numbers break down? I think we've got it here up on the screen. If you're between 40 and 54 and an average risk, you don't necessarily need to be screened. That's the latest data.
Right, exactly. So if you're an average man out there under the age of 55, you don't need prostate cancer screening. However, if you have a father with prostate cancer or close relatives, multiple close relatives with prostate cancer indicating some sort of genetic variant predisposition to higher grade cancer, you should get screened. But if you're under 55 and average risk, then do not. However, we are recommending between the age of 55 and 70, again 55 to 70, you should get prostate cancer screening once a year or every other year is what the newest guidelines are saying.
Very interesting, but it's all a work in progress and still a lot of scientific research to be done.
Right, and now at this instant in time we only have PSA as a cancer screening tool. However, in the next several years, and even right now, we're working on a lot of the advanced genetic screens, so we'll be able to tell you not only do you have prostate cancer, but what variant that you have, and is it especially aggressive. We're going to have that very soon, so we're working on that right now.
All right, Dr. Shah, thank you for coming in. I want to briefly mention Happy Father's Day to you.
Thank you so much.
Your first Father's Day.
My very first one, and it started with a big poopy diaper this morning. So.
Of course, and there she is. What is her name?
Anjali.
Anjali, she is beautiful, beautiful.
Thank you.
And hopefully no more accidents.
Hopefully no more accidents.